look at our competitors, ask them if they have this. I'm going to almost guarantee you that they don't. One is our collections module. Now, in the collections module, which I call it a module, it's really just the capability to everything comes with the system. The collections will provide your office a paperless workflow environment for following up on delinquent patients and also delinquent and denied insurance claims. It works well off of both patient balances and insurance claims, whether they're denied or old. So it works on both of them. The real key is you have a system here that is a workflow system. It's got events and cycles and letters that all get run at night in off hours, finding delinquent accounts and presenting the accounts that need to be worked on to your collectors in a paperless environment. The real heart of where this works is the collector work screen. So if I go in the collector work screen, and by the way, I can see all the pools here. We have, like I said, a patient side and an insurance side. If I'm Jill Dobbins, see, I get to see everybody because I'm the supervisor. Supervisor gets to see what everybody's working on. But Jill Dobbins, when she logs in, she will get the work pools that she's responsible for working. And you can see here how many are in that work screen, when it was last worked, etc., etc. And what the system does, it presents the work to the collectors, only the work that they have to deal with. I'll get into that even more. But our collection module has shown that it will increase your cash flow. You will collect the money faster, and everybody knows that the older money gets, the harder it is to collect. So the whole object here is to get any action items that need to be done to the collectors quickly in that cycle, so they don't have to sift through and see what's happened. The system, the computer, will feed them their work, and that's the real key. Other systems, they're report driven, or someone has to go in and see what happened, etc. Our system does all the auditing, prints all the letters automatically, rebuilds all the claims if claims need to be rebuilt. Only work that needs attention will get fed through this collector work screen, and that's what really differentiates us from the other systems. The fourth area is the recall module. The recall module is specifically for practices that need patients to come back into the practice for follow-up care, but it's something that's too far in the future to make an appointment now. You're an OBGYN practice. As a matter of fact, we wrote this for an OBGYN practice. So I know you have pap smears, you have mammograms, you have ultrasounds. The pap smears, depending on the result of the last pap smear, may be on a 3-month, 6-month, 1-year, 2-year recall. You can have all those various recall protocols, okay, what you want the system to do. Do I want to send them a letter? Do I want to call the patient, etc.? All of those protocols, similar to the collections module, are in the workflow of the recall module. And the number one thing that makes our system stand out from all the other recall modules is we check compliance. If a patient has an abnormal pap smear, you've recalled them for a pap smear. If they come into the practice and get a breast exam, they don't comply. So it's an automatic compliance based on us posting that service that we're recalling them for to the patient's account. I don't know of any other system that does that. Okay, and by the way, all of this is without the EMR. I mean, you could be up and running and not even have your EMR and have your compliance for your recall protocols all documented without having to even implement the EMR. I know we're going to implement the EMR in your practice, but most likely you're going to be running on the practice management system for some period of time while you bring your EMR up. But you will be having these recalls and have the system check compliance even before then. Okay? Again, in the recall, Dr. DeCoster? Yeah. I'm about to wrap this up. In the recall system, we have work pools also, because there may be a certain recall where the patients received a letter, but now we want to call them, okay? And again, it will feed recall ticklers where you need to call the patient to your recall coordinator or your recall nurse. Only the ones that have not yet complied that are in the place where they need a phone call. So it's also a workflow type of operation. The one other thing I also wanted to mention to you before we get in and actually start putting data in is I intentionally opened up multiple windows on my PC. I did that on purpose. If I go over to my window icon, you'll see these are all the programs that I've opened up, and I can flip back and forth between the programs right on my screen. So you can be in one program. I know that probably in your practice you have people that do multiple things. So they could be making an appointment, all of a sudden have to answer a question about some other patient, what's their balance, etc., then come back to where they were, and they don't have to go through menus, and they will return to the exact same spot as where they left. The other thing that's important is that our system, even though it has a very nice user-friendly Windows interface, we've actually created it so that we have shortcuts within the system, so that if there are plenty of users that don't like to use the mouse slows them down, they would rather just be heads down operators. We have throughout the system created shortcuts, so those people that are high data input people that don't like to use the mouse, they can navigate the system without having to use the mouse. In this particular case, I'm using the Control Tab key to go from one window to the other. And by the way, our windows intercommunicate with each other. So if I bring Candace Smith up in one window and then I want to go to another screen and do something else with her, I can drag her, okay, from one window to the other. So this is not the Windows that comes through where you can just open multiple windows on your PC that are unrelated. Our windows are all related to the workflow. So with that, at this particular point,